Good morning, everybody, and welcome to the Disability and Aging Community Living Advisory Committee, formerly the Olmsted Committee. Just a few logistics and housekeeping items before we get to the formal agenda. Live captioning is available as well as American Sign Language. You can enable captions by hitting the CC icon on your toolbar. The recording slides and transcripts will be posted to the California Health and Human Services Community Living webpage after the webinar. We are saving some time at the end of the webinar for public comment. Attendees joining via Zoom, your computer or an iPad, you can use the Q&A function to ask questions or click the raise hand button. Those who are joining us by phone, if you press *9, that will add you to the queue, and then we can unmute your line for comments or questions. And I think Kim will probably cover this a little bit later, but the Community Living Survey is live, and we're hoping to get your feedback by May 7th. And with that, I will pass it on.
Great, and thank you. And this is Dr. Mark Galley, Secretary for Health and Human Services. I'm sorry, the late start is on me, a little technical difficulty, and I'm coming to you off camera by phone because there were some internet connection issues from the computer. Nonetheless, it is a real privilege to be with you today. We've been looking forward to this day and getting started on this fresh start, building upon so much great prior work, not just in the last year, which it's exciting to talk about some of the amazing achievements in a moment over the last year, but really the decades-long work of the Olmsted Committee and so many other efforts over the years. I want to start by thanking, and as always, it's important to thank your own team first. Kim McCoy-Wade, Marco Mead, so many others at the Health and Human Services Agency, the California Department of Aging. Kim and Marco, just really deep appreciation for your leadership, your vision, and all that you did here. I want to thank all the stakeholders and our co-chairs, in particular, Eric Harris from Disability Rights California and Claire Ramsey from Justice and Aging. 40 consumers, family members, providers, advocates, experts who are serving on this committee, many returning with many years of service and others new. We're looking forward to engaging with you and working with you. Exciting that it's no longer just California Health and Human Services and our many departments. We have 5 agencies: California Health and Human Services, LWDA, CalSTA, Business Consumer Services and Housing Agency, CalVet. We have Cal-OES from the governor's office, and we have 7 HHS departments: DHCS, CDSS, Public Health, DDS, DOR, and CDA, all participating here. And I just want to say what an amazing complement of people across state government, across the Health and Human Services Agency, but most importantly, across our communities and counties in California to really build on partnerships and to see where we can go. So with that, I want to turn it to Kim and have further introductions of the entire committee. Thanks, Kim.
Thank you, Secretary. Next slide, please. We're going to do introductions and we'll do them in the order that they are listed on the slide. So if you can read your name and your organization, and we'll get through this and I'll help facilitate. We have such a wonderful group. We want to take a second so everybody can see who's here. Eric, can you start us off, please?
Yes, hello, thank you so much, Kim. My name is Eric Harris. I am with Disability Rights California as the Director of Public Policy and one of the co-chairs here today. And I'm really looking forward to being one of the co-chairs and thankful for Kim and for Secretary Galley for giving me this opportunity to hopefully be somebody who can help with leadership and help guide this direction as we bring back this wonderful committee.
Claire.
Hi, I'm Claire Ramsey. I'm a senior staff attorney with Justice and Aging. I'm the other co-chair along with Eric, and Also just want to say, super excited to be here and thank you so much for the opportunity. I know we're going to do a lot of great work together.
Valerie. Patricia.
Hi, this is Pat Blaisdell from the California Hospital Association. Longtime member of the Olmsted Committee and really excited about the reconstitution and new directions. Thanks.
Mariva.
Good morning, everybody. Mariva Brown. I'm a policy consultant for Senator Tony Atkins as Senate Pro Tem, and I have all of the human services and aging issues in my portfolio, and a former member of the, or I guess a member of the former Olmsted Commission, and I'm very glad to be with you today.
Michelle.
Good morning, everyone. Michelle Cabrera, Executive Director for the County Behavioral Health Directors Association. We're a new seat on this committee and really honored to be here representing the county safety net for individuals with serious mental illness as well as substance use disorder needs.
Erica. Blanca.
Good morning, everybody. Blanca Castro with AARP California, and just really honored to be on this committee and looking forward to the great work that we're going to do together. And just on a side note, I do want to say that I grew up with a mom who at the age of 39 had a stroke. And so I know very, very well what it's like to be able to be fully independent as she was till she passed away. So really looking forward to seeing what we can do in the next few months together. Thank you.
Jessica.
Hi, I'm Jessica Cruz. I am the CEO of the National Alliance on Mental Illness, and we represent families and individuals who are impacted by mental illness every day.
Susan.
Good morning, everyone. I'm Susan DeMorris, representing the Alzheimer's Association chapters throughout California, and I'm proud to be here today joining you all.
Sherry.
Hi, my name is Sherry Farina. I'm the CEO of NorCal Services for Deaf and Hard of Hearing. I'm also the chair of the California Coalition of Agencies Serving the Deaf and Hard of Hearing, where we provide direct services to the deaf and hard of hearing individuals throughout all 58 counties. And it's nice to be here.
Liz.
Good morning, my name is Liz Fuller and I'm with the Assembly Committee on Aging and Long-Term Care. Very excited to be here and very humbled by the company that I'm keeping today. Thank you for having me.
Lisa.
Oh. Lisa. I don't see, is Lisa deaf? Because I don't see someone waving me down. I'm not sure.
We'll circle back around for people who we don't see. Gabe. Gail.
Good morning, everyone. Gail Grounard. I'm policy staff to Speaker of the Assembly, Anthony Rendon, from the Long Beach, Paramount, Lakewood area. I staff human services and aging policy, and I'm really honored to be a part of this conversation with so many stakeholders who have so many years of expertise and knowledge. Thank you very much.
Joanne. Barbara.
Good morning. My name is Barbara Hanna.
Barbara, you went on mute, I think. We'll come back to Barbara. Susan.
Hello, everybody. This is Susan Henderson from Disability Rights, Education and Defense Fund. It's nice to be here with all of you today. Thank you.
Michael.
Good morning, everyone. It's Mike Humphrey, manager of the IHSS Public Authority here in Sonoma County. Thank you.
Corrine. Corrine, I see you. Can you come off mute?
That's always the kicker, is you think you're unmuted and you're not. Corinne Jones, I am president-elect of the Multipurpose Senior Services Program Association. I'm also a director of the program that serves the Multipurpose Senior Services Program serving Lake and Mendocino County. It's an honor, and I consider it a privilege to be able to be on this committee. I'm about all things older, elderly, or senior, so it's great to be here.
Kathy.
Hi, I'm Kathy Kelly. Can you hear me?
Yes.
Oh, thank you. I'm Kathy Kelly. I'm Executive Director of Family Caregiver Alliance in San Francisco, and also Director of the San Francisco Bay Area Caregiver Resource Centers. And we work with unpaid through the CRC system. Pleased to be here.
Eileen. Sunny.
(9:30).
Shireen.
Good morning, everyone. I'm Shireen McSpadden. I am today, I'm the Executive Director of the San Francisco Department of Disability and Aging Services. And tomorrow I transition over to lead the Department of Homelessness and Supportive Housing for San Francisco. That said, for me, aging and disability services is a lifetime focus and a lifetime passion, and I will continue really focusing on the needs of older people and people with disabilities in my new role, and look forward to working with all of you. Thanks, Kim.
Peter.
Good morning, everyone. It's good to be here with you all. My name is Peter Mendoza, and I'm a consumer representative of this committee, and I'm really glad to be here with you all.
Kim Mills.
Hi. Thank you, Kim. My name is Kim Mills. I am the founder and CEO of A Better Life Together. We provide supported living, independent living, and day services in San Diego County. I'm also the chair of I'm a board member of the California Community Living Network and chair of their Access and Equity Diversity Committee, and I'm happy to be here.
Lydia.
Good morning, everyone. Lydia Missalidis. I'm the Executive Director for the Alliance for Leadership in Education, Advancing Quality in Adult Day Services. I'm also a continuing member, as is Pat and many of the rest of you, from the Olmsted Advisory Committee, and also a member of the LTSS Subcommittee of Master Plan for Aging, and I appreciate the opportunity to continue to serve.
Marty.
Marty Yamamoto, California Disability Senior Community Action Network, CDCAN. I'm also a family member. My older sister had developmental disabilities. She died in 2003, and also an unpaid family caregiver now to someone who's part of my extended family. His mom had died, close friend, 3 years ago, so he's now living with me. He's 28 years old. He has Down syndrome and is on the spectrum. And so we're living in this house right now, all the issues that we'll be talking about in real time. And so this is something we've been wanting to see, this restructured committee in this way. Along with Lydia and a few others, I've served on the Olmsted Committee back since 2004. So thanks, and a shout out to everybody who's was a part in making this happen.
Gabriel.
Good morning.
Gabriel Rogan, Executive Director of North Bay Regional Center, supporting people with developmental disabilities and their families in Napa, Solano, and Sonoma counties. Very happy to be here.
Michelle.
Michelle Rousey, consumer advocate. Been on the Olmsted Committee for many, many years. I'm do IHSS locally. I was on the advisory board, was on the state IHSS advisory board, and also work transportation. Thank you.
Katie.
Good morning, everyone. My name is Katie Shinoda. I am new to this group. I am with Mercy General Hospital in Sacramento, specifically the Home and Community Reintegration Program for Traumatic Brain Injury. I also serve on the Traumatic Brain Injury Advisory Board that's through the Department of Rehabilitation. So our program is an interesting overlap of aging and disability, and I'm very impressed to see the variety of people and departments represented within this group. Thank you for having me.
Richard.
Good morning, everyone. I am the CEO of the Independent Living Partnership in Riverside County. Our mission is focused on transportation equity for older adults, people with disabilities, low income, chronically ill, sick, and alone and isolated people. And I'm glad to be here.
Sarah.
Good morning, everyone. I'm Sarah Steenhausen with the SCAN Foundation. It's a real honor to be here serving alongside so many stakeholders that I just hold in such high regard, and looking forward to a really important and engaging discussion and getting down to work. So thank you.
Robert.
Good morning to all. My name is Robert Mylan Taylor. I'm one of the consumer advocates of the new California Health and Human Services Disability and Aging Community Living Advisory Committee, and been a consumer advocate for 11 years of previous Olmsted Advisory Committee, which I'm going to miss. The job that I definitely did in that committee and now in this new committee where we're going to address issues of disability and aging is really important, and how to definitely get community living for them. And I'm also the vice chair and disabled consumer representative of the Lake County In-Home Supportive Services Public Authority Advisory Committee, where I address the issues that are really important to all the providers, the recipients, and union representatives of the county. And you just brought in my team partner, Corinne, that's going to express a lot of ideas. Corinne and I are going to be a team representing Lake County, and also Mendocino, but mostly, in my case, Lake, to address issues. So please take the feedback that me and Corinne will be bringing up to this new committee to address disability and aging community issues that is related to community living. Thank you so much.
Greg.
Good morning, everyone. My name is Greg Thompson. I'm an executive director of the LA County Public Authority, PASC, clinical social worker. Previously was with Rancho Los Amigos National Rehabilitation Center, where I was the executive director of social work. Very glad to be here, very focused on in-home supportive services and improving the program. Thank you.
Janie.
Hi, everybody. Janie Whiteford. I'm with CICA, California In-Home Support Services Consumer Alliance. I am delighted to be here, seeing so many faces of folks that I served with many years on Homestead Committee, and really looking forward to working with the new folks that are on this committee. We have our work cut out for us, and I just hope that we can move forward and really provide some great programming for our seniors and persons with disabilities. Thank you.
Kate?
Hello, everybody. My name is Kate Wilbur, and I'm on the Leonard Davis School of Gerontology at the University of Southern California. One of my roles is to do research focused on long-term services and supports, and I want to echo what other people are saying. It is indeed a great privilege to be on this committee.
Sylvia.
Hi, my name is Sylvia Ye. I'm the Executive Director for Friends of Children with Special Needs, a nonprofit agency serving the development disability in Alameda County and Santa Clara County. We provide childcare, family support, day program, support living services, and support employment services, and also transportation services. I'm very, very honored to be in this committee. Again, I'm very new to this committee, and I, really be here to learning a lot of things. Thank you.
Alana.
Good morning. My name is Alana Yorkshire. I am an intensive treatment care foster parent to a kiddo in our system and other kids throughout the years. I'm also the Deputy Executive Director of the Adult Skills Center in the Los Angeles area. We have done quite a few initiatives with successful aging within our community, as well as we have very innovative dual diagnosis, mental health and IDD programs, crisis services, ILS, SLS, and day services. I'm also a member of the Safety Net group, DDS Safety Net group, and I appreciate and I'm humbled to be among so much talent. Thank you.
Thank you. And I have to do an addition. There are 3 stakeholders whose names are not on the list. So let me give them a chance to introduce themselves. Eric Dowdy.
Hi, Eric Dowdy with Leading Age California. We represent the spectrum of services for seniors, including home and community-based services, affordable senior housing. And I also chair the board of the California Collaborative for Long-Term Services and Supports. And I'm very pleased to be with you all today. Thank you for having me.
Christina Mills. And Rosie Ryan. Rosie, I see you. Can you turn your camera and your microphone on?
All right, can you guys hear me?
We can now.
Good morning. My name is Rosie Ryan. I represent the State Council for People with Disabilities, and I live here in Shasta County. And this is my first time to be on this committee, so I'm very excited. I'm also a self-advocate.
Thank you. Are there any stakeholders who did not have a chance to introduce themselves? Barbara, you had technical difficulty, or other people who are joining late?
If you were not able to hear me, my name is Barbara Hanna. I'm representing the California Association of Health Services at Home. I am a provider under the Home and Community-Based Alternative Waiver. By training, I am a PhD trained registered nurse with areas of interest in home care and its effect on quality of life and outcomes in terms of staying in the community. I thank you so much for the opportunity to serve. I've been on the Olmsted Committee along with several other members here since the inception back in the early 2000s. And I look forward to serving with everybody here. And it's an impressive group of people. So thank you.
Terrific. And Christina Mills is in the public. We'll move her over in a second to introduce herself. But let's now turn to our state members. We have multiple agencies and departments. Let me see. Department of Public Health, Dr. Aragon, or other representatives here? Department of Developmental Services, Director Bargeman.
Hi, good morning. Nancy Bargeman, Director of Developmental Services. Thank you.
Business Consumer Services and Housing Agency, Secretary Castro Ramirez or Undersecretary Grant?
Hi, good morning, everyone. Undersecretary Grant here on behalf of Secretary Castro Ramirez. I'm also joined by our Deputy Secretary, Lynn Von Koch-Liebert, and we definitely look forward to the conversation today. I will also just add, as some of the previous folks had mentioned, I'm a daughter of a retired military veteran who I am the primary caregiver for, who I just moved back from Atlanta, and who is recovering well from respite care. So this issue is definitely not only top of line for the agency, but for myself as well. Looking forward to the discussion. Thank you.
Department of State Hospitals, Director Clendenin.
Good morning, Stephanie Clendenin, Director for the Department of State Hospitals. And the state hospital operates the state's acute psychiatric hospital system. We treat individuals who with serious mental illness, who many of them are justice involved. We also operate the statewide conditional release program for individuals who are transitioning back from the state hospitals into community living. We're a new member of the committee and looking forward to working with everyone on this very important work.
Thank you. I'll skip the secretary to the next slide, please. Department of Veterans Affairs, Secretary Imbasciani.
Hi, I'm not sure if my video is working. This is Thomas Martin on behalf of Secretary Imbasciani with California Department of Veterans Affairs.
Thank you. Welcome, Thomas. Department of Social Services, Director Johnson.
Good morning, Kim Johnson, Director of the California Department of Social Services. Glad to be here in partnership with each of you. There's a number of different representatives that are joining me here from the department, and we look forward to working with everyone. Thank you.
CalSTA, the State Transportation Agency, Secretary Kim and Deputy Secretary Avital Barnes. Department of Healthcare Services, Director Will Lightbourn.
Hi, this is Anastasia Dodson from the Department of Healthcare Services. Director Lightbourn is on, but there may be some technical issues, but we're happy to be here.
Right. Sorry, Will Lightbourn.
Thank you both. Labor and Workforce Development Agency, Secretary Sue or fellow Julie Figueroa-Madonna.
Good morning. This is Julia Figueroa-Madonna representing Secretary Sue, who is very sorry she couldn't be here this morning. She wanted to extend her gratitude as a new member of the committee for being included. We're very eager as an agency to learn about and contribute to the work of the committee, and we want to commend the HHS leadership for striving to integrate and align the work of the various agencies so we can better serve older Californians and Californians with disabilities. Thank you.
Governor's Office of Emergency Services, Chief Vance Taylor.
Hi, this is Vance Taylor with Cal OES. Just delighted to be here. Very glad that OES is a part of this conversation and recognizing the need to ensure that independent living accounts for the fact that it's a very diverse emergency landscape out there. So I'm pleased to be a part of the conversation and look forward to this process.
Department of Rehabilitation, Director Xavier.
Good morning, everyone. Joe Xavier, Director of Department of Rehabilitation. Good to see so many familiar faces and looking forward to the work before us.
And I do think Christina Mills has made it in. Christina?
Good morning, everyone. Christina Mills, Executive Director of the California Foundation for Independent Living Centers, representing 24 of California's Independent Living Center network throughout the state of California. Pleasure to be here this morning. Thank you.
Well, welcome to you all. I know that took more time, but it was worth every minute to hear and learn about all of our interests and expertise and commitments. So thank you for that. We will make up the time, although we do have a very full agenda. But now that we are all connected, let's talk about why we're here. And to kick that off, we have Secretary Galley and our stakeholder co-chairs, Eric and Claire. We'll follow that by hearing from 3 people on our committee with lived experience, and then we'll open it up to the whole committee for discussion. So Secretary Galley, can I hand it back to you?
Yes, and thanks, Kim, and really incredible group of people. I too am humbled by the talent, experience, expertise, and I know the focus on action. Just great to hear the former members of the Olmsted Committee invigorated and excited about the work we'll do here, and new people joining us from a number of groups, agencies, and departments that previously weren't part of this important work. I'll just say that the goal for all HHS agency work and initiatives is to be person-centered, data-driven, equity-focused, and integrated. And this committee strives to do all of that. I think the focus on cross-department work, aligning programs and focusing on whole person views of community living are going to be key moving forward. We want to make sure that we are supportive of each department's expertise and leadership and allow space for that perspective to be shared and molded so that the state leads with programs that are truly designed for people by people with that lived experience. I know that there's so much going on as we come out of the hardest part so far of the pandemic, and we move into this critical period where the state moves forward with new budget actions, a new focus on Medicaid and CalAIM, new programs around behavioral health, and so much that is invited. Great to hear Michelle and Jessica and others part of the committee that represent the behavioral health work across our state. I know that we have a long history of being focused on equity and the intersection of race and ethnicity, and building upon those principles as we look at disability and aging is going to be key. We did rename the committee, expand the membership, but I think this really builds on the prior work of the Olmsted Committee. So many inaugural members back in the early 2000s who came together on a regular basis, stubborn advocates for change and improvement in our system, and their work will only be built upon here. The success of the Master Plan for Aging, the Alzheimer's Prevention and Preparedness Task Force, and huge milestones in our past, recent past, of things like closing the developmental centers and focusing more on community living. We have so much to build upon. I'm looking forward to working with the other cabinet secretaries and those agencies to really have an all of state government approach. And of course, remembering how all of this work really happens locally. The state can really fuel and set a bit of the heartbeat with all of your work, but we have to pay attention. And I'm pleased to hear all of the local leaders, all the way from Los Angeles up to Lake and Shasta, and so many counties in between. I'm sure I missed somebody from San Diego and all the way up close to Del Norte and Siskiyou, but it's a really amazing group, not just of talented people, but with voice and perspective from the representative parts of our state. We begin to now emerge from the pandemic. I know our team has worked tirelessly, like so many of you, to protect Californians, especially those where the threat and real disproportionate impact of COVID has been heartbreaking and the losses enormous. But as we stand here today and we see our efforts around vaccinations, although imperfect, although never the pace we wanted, have some major successes. We see case rates come down in California to some of the lowest, if not the lowest in the nation. It really is this tremendous chance to build upon that work and accelerate this shared vision and commitment to community living in California. Many of you heard me call COVID the great unmasker of disparities and disproportionate impacts and inequities, but also a great accelerant for change and positive change. And I believe our group will keep working and building on those COVID lessons. There will, of course, be opportunities to think about new state-funded efforts, as well as this tremendous opportunity that the new Biden administration has given with federal resources to focus on everything from housing, transportation, caregiving, the care economy, jobs, and the wonderful work that needs to go into a thoughtful community living framework. My goal in sort of in ending is to really build this collaborative expectation across all of those represented here, that this concept of nothing about us without us is centered and anchors our work, and that we are action focused. The process is important, but the product matters too. And so What I loved to hear in the introductions was the history of each of you who've been part of this committee. I know the public who will chime in and share their viewpoint is really action focused. How are we going to make the concepts discussed, the ideas that are put on the table, challenged, beat up a little and improved? How are we going to apply those to the policy that allows us to move forward with confidence and with speed to create a better California for all? So with that, I want to turn it over to Eric and Claire and just thank them again for their willingness to co-chair and the honor to work with Kim and team to see this work through. So thanks again for joining us today.
Thank you so much, Secretary Galley. My name is Eric Harris, as I mentioned earlier, and I'm with Disability Rights California as the Director of Public Policy. I'm really looking forward to work with Claire Ramsey as co-chair of this committee. Thank you also to Kim McCoy-Wade. Really appreciate all of the great work and leadership that she does for our community. Just so you all know a little bit about me, I was born with congenital hip dislocation, which gave me nerve damage in my left leg, my right foot, and right ankle. And I'm a wheelchair user, and I've used a wheelchair for the majority of my life. I have been with Disability Rights California now for a couple of years, working both in policy and then strategic partnerships and community engagement. Prior to coming to Disability Rights California, I spent some time working in policy at the state level with the California State NAACP, worked in Washington, D.C. for Congresswoman Barbara Lee, as well as the Democratic National Committee in Washington, D.C. So spent plenty of different experiences with disability organizations like the American Association for People with Disabilities and other disability organizations throughout the country, working on policy that impacts our community. I want to kind of piggyback a little bit off of what the Secretary mentioned. We all know as a community, the disability community, that COVID has been detrimental to our community in so many ways. We are disproportionately negatively impacted when it comes to deaths, disproportionately negatively impacted when it comes to hospitalizations. And we know that work is far from over when it comes to making sure that the disability community is heard, that the disability community is seen when it comes to coming out of this pandemic. As we are now able to get more vaccines, we know that there are still many within our community who are not able to get vaccines, whether they are in homes, whether they are unable to travel, to get to locations to get vaccines. And we know that this is still a priority for our community, and one that the community has been speaking about for a long time and really wants the state to recognize and to do something about. And so we're really excited to have everybody here today. We know that we not only need to look at this from a cross-disability perspective, but also an intersectional perspective regarding ethnicity and race and gender. Many people with disabilities who are Black, Latinx, Native American, AAPI, LGBTQIA+, face additional challenges and face different challenges than those who are not part of those communities. And Claire, myself, and Kim really want to make sure that the voices from those communities are highlighted and lifted up as we work to accomplish many of the goals that we hope to accomplish. And I know that Claire is going to also talk about some of our goals and objectives, but we really do want to hear from the community. We really do want to work with the community and accomplish the goals of the community. And so that's why, as you all can tell from the agenda, we've tried to set a good amount the agenda aside for public comment and hearing from the community. And not only do we want to hear from the community, but we want to set some action steps and accomplish some goals to really get at what the community needs during these times. So I'm really, really excited to work with all of you. I have looked up to many of you as mentors and leaders within the disability community, within the aging community. And as you all know, Disability Rights California is dedicated and prioritizes the issues of the disability community, the issues of the aging community. And I hope to be a good representative, not only of Disability Rights California, but hopefully I can be a good representative of this community, and we can accomplish many of the goals that we hope to accomplish. So thank you so much.
Claire.
Thanks, Kim. And as everyone has already said, but I just could not skip through this, I just want to say how humbled and appreciative I am to be sitting with so many people who are bringing years and years of advocacy experience, lived experience, just deep passion for this work. And we really want to thank Eric and Kim for being such great partners as we launch on this journey together to really focus and highlight and create sort of, I think, a lot of new opportunities for community living in California. And I think one of the things I just feel so excited about by all of this work is just hearing how we are really building upon such a solid foundation of all the work that's come before us, of all the people who have fought and moved us forward on all these issues. And then I feel like we're right at this point now where we can really, take off and find how we can do even better in California to make sure that our community living isn't just an aspiration, but is a reality for people. And I see that really building on not only the work of the former Olmsted Committee, which has had so many years of great work, but also all the work that was done through the Master Plan for Aging. For those of you who've been in the aging space for a long time, I know that you probably are just in some ways still almost shocked at the amount of thought and attention and conversation that has really come forward around aging. It has not necessarily been something that has been at the forefront of people's policy thinking, of people's advocacy. For some of us it has, but it's really kind of a huge shift to see that the administration, the legislature, the community advocates, the providers, I just see this huge shift in the conversation and the landscape and the possibilities because of all of that coming together. And I think this committee is really representing that in the most wonderful fashion. Just hearing that we're going to see in this committee representation throughout California, all the different counties that are represented, all the different communities, that we're really seeing this through an equity lens. And we're really going to work hard to make sure that our work is going to advance community living equitably for all Californians. And I appreciate Secretary Galley talking about how we do that through data, how we do that through investment, how we do that through real sustained focus on these issues. And the way I just am continuing to think about this is that we work through this committee continually thinking about communities living as our North Star, and that the programmatic pieces that we're talking about are all to support that, and that we don't feel compelled to stay within the bounds of what is, but that we are really visionary and we think about what can be and what should be and what could be. And I think just to, loop back to say that I know that COVID, and the fires and, racialized violence has really just made people so worn down this year and has just been so painful. And the flip side of that is that we have really seen these communities come together, rise up, work harder than they've ever worked to make the state a better place. And I feel like this committee is part of that work. And I'm just really proud to say that. And I realized I jumped right over. And just so for those of you, I know many of you, but for those of you who don't know me, I'll just say very, very quickly. I work at Justice and Aging. I've been there just about 5 years. My work is really heavily focused on healthcare and LTSS. I come from a legal services background. Initially, my work was actually around disability and children in the childcare space, and then moved on to doing older adult work with direct services in elder abuse and public benefits and healthcare, and then now at Justice and Aging. And I was a member of the LTSS subcommittee and really proud of all the work we did there that I think we can build on, and just really excited to work with all of you. So thanks, and with that, I'll turn it back to Kim.
Thank you. And as all the chairs agreed, we wanted to start and always be informed by the lived experience of community living. So we've asked committee members, Peter Mendoza will be first. Rosie Ryan, I'll ask you to be second. And I don't think we've had Lisa Gonzalez join us. So we'll do Peter, Rosie, and then see if Lisa's here. Peter.
Good morning, everyone, and it's so good to be here with you. You know, I bring to this committee, and I should mention that I'm an alum of the Homestead Committee, and grateful to be here with all of you. I come to this committee with a long time of lived experience and disability rights, and a person who's navigated both the blessings and the challenges of community living. First, though, I want to thank everyone, Governor Newsom and the administration, and everyone that works to advance the Master Plan for Aging, and all the wonderful things that California is doing to support community living. As we gather here today, it's been 44 years and 2 days since the occupation of the federal building in San Francisco to enact the 504 regulations. It's also 31 years since the signing of the Americans with Disabilities Act. And since our work has gathered based on Olmstead, it's been 22 years since the Olmstead decision was signed. I say that today because community living is so important to me and our community. As a person with cerebral palsy who needs assistance with limited use of my extremities, I need assistance with virtually all aspects of community access and activities of daily living. So everything I do with the assistance of another person and through assistive technologies. I've utilized some governmental systems or programs to make my way through life. In the past, I utilized the Housing Shortage Voucher Program, in-home support services, and now I primarily receive services through the regional center system. One of the things that's important to me as I age, you know, when I was young, and I'm in my 50s, they talked about in the regional center system that we provide supports from the cradle to the grave. Well, now that I'm in my 50s and closer to one side than the other, I prefer talking about living the full life experience. I am fortunate to have wonderful people in my life and a strong community and a job I love at the Marin Center for Independent Living. I am fortunate I have systems set up and many supports that for the most part I navigate okay and enjoy life. There are still problems that people with disabilities like myself have navigating community. It is difficult sometimes for us to find employment. It's difficult for us to access healthcare. I'm grateful that in the past I was able to utilize Medi-Cal and Medicare for community living. But these are difficult systems to navigate. And sometimes during COVID really exemplified some of the gaps that we have in community living. It's difficult for many folks to find home care providers for direct care, whether in the regional center system or, for example, in-home support services. Many of our valued community members who receive in-home support services report that because of this difficulty, they're having difficulties getting care, and in some cases have been in bed or not have people able to cover shifts from several hours to weeks. These are inequities that we must recommit to change. The regional center system is based on the Lanterman Act, which is the Civil Rights Act for people with developmental disability. It is an entitlement program. It is based on a person's need and not necessarily on income. We need to work for an entitlement program for all. As I get older, I also have family members that are people with disabilities. And I not only, as we develop our system, I want to make sure that they're also supported. I want to honor my parents for making sure that I started on the road for independence. Community living is so important. All of us, with and without disabilities, have the right to be able to fully participate in all activities of daily life, just like everyone else, just like those without disabilities. We must work even harder in our work to make sure that we combat racism, ableism, ageism, and all the other isms that impact our lives. I also wanted to point out that people with disabilities and older adults need to be seen as equal partners in the system. When I'm at work, I'm in my high power mode. I get treated with respect. But when I have to utilize support through the system, oftentimes I'm treated like I don't know what I'm doing, or because I have a need, there's something I didn't do right. We all do our best to manage our lives to be as independent as possible, or interdependent as I call it, because we all rely on the support of others or services. But it is not our fault if the system breaks down and we need supports. This is especially true during COVID. During COVID, it was hard for many of us. And frankly, the system didn't have a lot of answers either. And I want to apply all of the work we did to support folks during COVID-19. But there were significant gaps. And people with disabilities were often told that we were the ones to blame for not having our system set up right. All of us, I think, would agree that COVID was a whole new phenomenon. I look forward to the day when all of us have the equity and the supports we need based on need, so that we can all have full lives. And just one more thing before I close. I also want to honor all of those who care, who support us. We must advocate for decent wages and benefits and job security for those who support us. At the same time, we have to establish systems so that everyone who needs home care has access to it. And not just home care, but all community living supports. Thank you very much. And again, it's a pleasure to be with you all today, and I'll pass it back to Kim.
Thank you, Peter, for that history and that vision for the future. Rosie, Brian, can you turn on your camera and join us?
All right, is that much better?
We can hear you, but we can't see you, but that works.
Okay, so my name is Rosie Ryan. I lived with my mom for a while. I had my mom, you know what, it's time that I leave you. I love you, but so
Rosie, we're having trouble hearing you. The connection is breaking up a little bit.
I was happy there, the rules down and even further. And I wanted to get my own apartment, so I put a deposit down and moved back into town. But there I had ILS worker come in and teach me cooking skills, shopping, budgeting, and how to be safe. I had jobs, and I went to live with friends. That moved
Rosie,
to
I'm so
Shasta
sorry. Rosie, I'm so sorry. We're not able to hear you very well. We will. I'd like to keep trying for another minute or two so we can see if we can hear you. And for sure, we will take your written remarks and put it in the meeting records if we aren't able to overcome the digital divide right now. But let's try for one more minute and see if we can hear your story.
And this was written last night, so I'm trying to remember the key points of this story.
You're doing great. We heard about you living in your apartment, and we heard about the independent living services that you received.
So anyway, now I'm here in Shasta County. I have an apartment that I share with my roommate, and we have staff that come and help, at least my roommate. But it's great to be a part of this committee.
Thank you, Rosie. We will get your full statement, and thank you for sharing with us here as well. I would like to ask the committee members both to participate, but also for your help. And if I could, we want to talk about the purpose, but I know you all know we also have a very full agenda that we want to tee up all the major opportunities this year is presenting and this moment is presenting. So here's my proposal. The purpose of the committee is posted on the CHSS Advisory Committee webpage. There is a survey that is posted that will be available to all members and all the public, please, the public, to weigh in on if that purpose, if we got it right or if we missed something. So what I'd like to do here is maybe take one or two comments from the committee, try to keep it under 5 minutes so that we can quickly turn to what the leadership identified as the major opportunity for community living this year is home and community services. And we want to take some time to dive into that before our needed break. So is there any committee member who feels called to make a brief one or two statement about the purpose before we turn to home and community services? Let me create a couple minutes of space. I see two hands. Let's do that. Marty and Michelle, and then that'll be perfect. Marty.
Marty Emoto, family member, CDCAN, California Disability Community Action Network. Thanks for all the presentations. Really quickly, just want to raise a point that was raised by a couple of my advocate friends, that there needs to be, the committee needs to consider the inclusion of people who are blind or sight impaired. That apparently is missing from this committee, and I'm assuming it was inadvertent, and I think I agree with Regina and Jeff Tom that this needs to be corrected. The other is, and it's really addressed to Secretary Galley and the others, to consider the inclusion or invitation of the education community, including the Department of Ed and higher education, because both are very important towards our, on track on the issues of employment and trying to, retool how people are learning in school so that they are on the right path towards inclusion and employment. And so they include special ed, but also the larger community of education. And so hopefully the secretary and the others will consider both points that I just raised here. And again, thank you for doing this.
Thank you, Marty. Go ahead, Secretary.
Yeah, no, just thanks, Marty. And yes, sure Kim's going to go there, but two important points, and we will certainly.
I'll try to finish the sentence. Just one clarification. There is a member from the California Council of the Blind, Gabe Griffith, who is named to the committee, who isn't here today. So we'll follow up on that. And then again, thank you for the education input. Michelle.
Michelle Rousey. I believe community supports are needed in a way that meets the community's needs, and the consumers who use them need to participate in making sure those services are what they need and are provided to them in a way that they can use them. I believe if we don't have proper housing and those supports for housing, we lose those people being able to be in the community for those community supports. So I think a real big focus needs to be on housing. Thank you.
Thank you. So what we'll do now is we'll do our, I don't know if we can call it a deep dive if we're going to do it in 20 minutes, but we will. I'm going to ask us that we try to do here is hear from our stakeholder in less than 5 minutes and hear from our leaders at Department of Healthcare Service and Labor Agency in less than 5 minutes each. And then we'll have less than 5 minutes per committee, and that'll give us to about 10:30 and we'll have our break. So let's see if we can do that. The challenge is on. Claire.
I am a fast talker, but I'm also going to be very respectful of our interpreters since they have to keep up.
Thank you.
I do have a couple of slides, and I don't know if we can advance to the next slide. Thank you so much. Obviously, this is going to be a super high-level overview of major opportunities in long-term services and supports. And just very quickly, and it's fine to be on the slide, just quickly so we're all using the same terminology. When I talk about LTSS, I'm talking about both long-term institutional care, like LTC, and home and community-based services, HCBS. So that term to me encompasses both those pieces. But a lot of the opportunities right now really are on the HCBS side and are really potentially here to support community living. So I want to go through three major pieces of this, and they're huge in and of themselves, so I will be quick though. First, there are some major and unprecedented federal opportunities. The first one, the American Rescue Plan, has already passed. The big piece there is a 10% match that has bumped up on Medicaid. So just so everyone is clear, we get 50% for most of our Medi-Cal programs, reimbursement from the federal government or a match from the federal government. The American Rescue Plan includes a 10% increase for all HCBS services. This could mean as much as $2 billion more for California. So it's a really significant investment in real dollars. However, it is not at this point ongoing money. It is basically authorized from April 1st of this year through March 31st of next year. There are a lot of questions about how that money can be spent because it must supplement, not supplant, our own state dollars. But the federal government and CMS is working on that guidance right now about all these questions about how we can spend the money. So, but that right there is an immediate real dollar investment opportunity in HCBS. We also are seeing that there are future possibilities that are on the horizon. And very quickly, there is something called the HCBS Access Act that is right now in a draft, a stakeholder draft to review that would make HCBS an entitlement within Medicaid and not an optional benefit, meaning that it would be a required service and people and states couldn't look to cut that benefit in hard budget times. It would be a required service under Medicaid. The other one is the Infrastructure Act, which you may have heard about because it includes potentially $400 billion for HCBS. And President Biden spoke about that a little bit in his speech earlier this week. Again, lots of questions what that will look like. It is not, neither of these have passed or even close to passing right now, but they are in the conversation and they are really starting to talk about community living and home and community-based services in a different way as really this foundational piece of our infrastructure and as basically one component that people need to live healthy, safe, happy lives. We can go to the next slide. So that's federal. we have a lot of opportunities right now legislatively and within the budget. And that is really largely in part to the administration really including budget priorities within his Governor Newsom's January budget, the legislature really taking up a large number of bills, multiple dozens of bills to advance the master plan for aging, and advocates and stakeholders demanding those actions and pushing and including even more potential stakeholder budget requests. So we have a lot of possibilities. If you have had a chance, we have a bill list related to the MPA. It both includes LTSS bills, but far beyond that, basically within every goal area of the master plan. And then there are numerous budget proposals, including in the January budget, a number of stakeholder requests. This slide was created last week, so we had the Senate budget priorities were out, but now we also have the Assembly budget priorities, and both include pieces that will expand access. And now we're looking forward to the May revise to see what else can be done with these new investment opportunities coming in from the federal government and from the fact that California's revenues are much higher than anticipated. Next slide, thank you. And we also have administrative opportunities. This committee is one of the opportunities. But I just want to remind everyone that the Master Plan for Aging came out in January. It contains 5 bold goals and 132 initiatives that are supposed to happen in the next 2 years. Many of these either involve LTSS or intersect with LTSS. And I think that's really important to highlight what Michelle just said, which is LTSS is amazing and great, and home and community-based services are amazing, but if you don't have a home to live in, where are we getting those services administered? So we really want to look holistically at this and really think about what is needing to support the community living. Having all these departments and agencies here is just amazing, because now we're going to be able to see the engagement on all these issues with all these various agencies and departments. And then lastly, I just want to say we're not, and we've talked about this, we're not starting from zero. There has been so much foundational work, so many advancements over the years that we're really building off of amazing work already done, both by the original Olmsted Committee and within the Master Plan for Aging LTSS subcommittee. There was a big report issued, and I just want to remind people that is there because a lot of amazing thinking from a lot of people went into the recommendations there, and just to keep building off that. And we do not have to sort of start from scratch about what ideas do we have. We can really start from, here's a ton of ideas. We may have more amazing ideas, more opportunities, but we keep building and growing and moving forward. So hopefully that was fast enough. Thanks, Kim.
Perfect, thank you. Department of Healthcare Services, take it away.
Great. Good morning and thanks. Will Lightbourne, Department of Healthcare. If we could advance the slide, please. But great. The things I want to just focus on are items that are in the works now and that we'll see deployed in the months and several years ahead. One of the largest of those is the CalAIM initiative, which really is a redesign of our state Medi-Cal system, both the delivery, the program side, and payment reform. And among the major goals of CalAIM is to include in our suite of services those non-medical clinical services, the social determinants that really so largely affect health outcomes. And through a sort of a process of both enhanced care management for people with the very highest needs, as well as a series of in lieu of services that our health plans can deliver because they clearly have advantage to health outcomes. This will be a very significant shift in the Medi-Cal program. Among the in lieu of services that will be included are transition services for people to emphasize either living at home or in assisted living settings as opposed to nursing facilities, housing services in the form of navigation and securing housing, and then respite and medically tailored home modification, medically tailored meals, home modifications, and supplemental personal care services. As part of CalAIM, we're also going to be developing a network of DSNP plans for dual eligibles. And we're working now with stakeholders to develop the contract requirements for the DSNPs that will start to become statewide in 2023. Anastasia Dodson, who's also on the meeting today, has been leading that effort for us. As was just mentioned by Claire, the American Rescue Plan has enhanced federal funding, and there are proposals under development for the state budget. And we are monitoring the new proposed actions, both in the President's infrastructure proposals and in Congress's Access Act. As part of COVID, the department extended a number of flexibilities for home and community-based services to make them usable and effective in setting, even though it was for extended periods, it was not possible to have congregate settings, and those continue through 2021. CalAIM and everything else we are doing has a huge focus on addressing disparities, identifying them, and closing inequities and gaps. If we could go to the next slide. One of the, I think, very significant things that will be happening in 2021 is DHCS is creating an Office of Medicare Innovation and Integration. And the goal here is to address both issues relating to dual eligibles, but also specifically for Medicare-only individuals. We believe that there are opportunities to work with the Medicare Advantage plans to increase the availability of services similar to the social determinants of health that we will be developing in CalAIM. And this will be sort of our goal. We're working closely with STAN Foundation to look at opportunities in this space. We are submitting a request to Federal Health and Human Services for a supplemental planning grant attached to the Money Follows the Person program, which we think of in California as CCT. Our intent is to use this in partnership with all of our stakeholders, many of whom are this body today, to really look at a sort of a remapping of our home community-based service system and to identify what opportunities there are to close existing gaps and strengthen provider networks. And finally, this summer we will be developing a new home community-based alternatives waiver. And so we've been working with stakeholders on a number of recommendations, and we will release the revised waiver in summer for a comment period. And the goal is to have the renewed waiver starting in 2022. So I think I made it within my 5 minutes.
Thank you very much. Pat, labor agency, please. That's graphic, by the way. Thank you. Julia, you're still on mute.
Sorry, next slide, please. Okay, so I just wanted to start by giving a basic overview of who we're talking about when we talk about the direct care workforce, which is the purview of the labor agency. I don't think it's a surprise to anyone to learn that there's a huge shortfall, right? That all of the direct care occupation categories are the fastest growing, both in California and in the nation. And in the wake of COVID, also the most dangerous occupations. They're also some of the most poorly paid. So in the interest of time, I'll just summarize this slide to say that, the majority of this workforce are women of color who are doing, despite the way that their labor is devalued, as anyone who has either received or provided this labor or has a family member who has can attest, it's very difficult very skilled labor that they're performing for most often poverty level wages. A couple of statistics that aren't in here that are also interesting is that it's an aging workforce. Over half of the workforce is over 45, and way less than half of them have any sort of health benefits associated with their work. So they are facing many of the same, obstacles to maintaining their own health as their clients are. So I give this background mostly to provide context for the labor agency's focus on the connection between, quality care jobs and quality of care, in addition to increased access to care. Because obviously, if we have more care workers, the access to care will be improved. Okay, we'll move on to the next slide. So this just a couple of interesting statistics that came out of a report that was put out by Leading Age late last year. In terms of the economic impact of a living wage, it would provide an additional economic output just in California of 3.6 million, public assistance savings of 165 million, and could potentially create 50,000 new direct long-term care jobs. Next slide. In terms of the impact on the quality of care, clearly it would increase staffing and retention. And all of us obviously already knew how important that was prior to COVID. And unfortunately, COVID provided a very grim demonstration of that fact. It would decrease turnover, which would result in 1.3 billion in savings nationally, increase productivity. And there have been studies done in California demonstrating that the increased wages and training lead to fewer urgent medical interventions, and therefore lowered costs as well. This is just a brief overview of our care initiative strategy. The first, convening the Direct Care Workforce Solutions Table, comes directly from the LTSS subcommittee, the Master Plan of Aging, and is one of those formal goals. I'm going to focus right now on the bottom right-hand corner, which is investing in pilot and demonstration projects. So we can go on to the next slide. This is a sort of very general overview of some of the initiatives that we are in the beginning stages of planning. Obviously, we are eagerly awaiting more guidance regarding the funding that Claire described as well. And we just emphasize that, much of what the Biden administration has said about the ARP funding and the American Jobs Plan funding is, talking about this expanded notion of infrastructure, which Claire emphasized. And also saying that, the care infrastructure and the human infrastructure includes the people who provide the care, which is our focus. So we have plans for several different demonstration or pilot projects, which are listed here. One in the context of IHSS to measure the impact of increased training and wages on quality of care and cost. Cooperative home care staffing agency, which is important on a variety of levels for ensuring quality of work and care. But I think it's important to say and acknowledge that a large portion of the workforce in the care sector is undocumented or unauthorized. And this is a model that allows their full participation in the workforce. A universal care worker pilot and more than one hybrid direct care worker training pipeline programs, all of which are pending funding and coordination with HHS, of course. And I think that's it.
Thank you to the three of you. Let's take the break slide down actually, and let's see if we have one or two committee members who want to make a comment on this opportunity before we do head to that break. Robert.
Yes, thank you. This is going to be very short because we're going to go on break. So I agree with Michelle. Housing is very important that we address as part of community living, not only for the disability community, but also for seniors, also known as the aging community. But let's don't forget, in rural areas like mine, transportation is important. We got to get to locations where people can go to jobs and definitely be at their homes. And we need more employment more than ever. Now that we're going to get out of COVID, maybe next year or so, we got to increase how we're definitely going to get more people involved. And I'm a strong person for a minimum wage of $15 an hour. That's really, really important. If we can definitely get it to all the sectors, that will be great. So I hope when we go into the round robin and we definitely go into the next section of this after we have the break, I hope we definitely get more comments from our members on this.
Thank you. It's an excellent preview of our next section. Susan Henderson, to be clear.
Thank you. I just have a question. I was thinking, you know, the president recently signed the executive order raising the minimum wage to $15 for federal contractors in place. Will that impact or benefit IHSS workers in California? It's a question for you to consider.
I will look to CDSS or labor agency to see if you have an answer on the IHSS connections there.
Will, I don't know if you have a definitive answer on that, but IHSS workers are not considered federal contractors. So my guess would be the answer to that is no.
All right, and we'll see if we have another different answer, but we'll take that for now. We can follow up more if need be. Any other committee comments on home community-based services and work and direct care workforce opportunities before the state at the moment? Christina Mills.
Hi, Christina from CFILC. I just want to make sure that we really think about what we accomplished in the master plan for aging. And while this conversation fits into that very well, it's important for us to think about how we continue to grow our aging and disability conversation around LTSS and specifically housing, since we've covered that today. One of the things that I think each of our communities does a really good job at is creating initiatives to further increase the housing availability for our populations. But I think that it's really important that as we continue to really work towards community living for folks with disabilities across the age span, that includes, of course, older adults, that we take into account things like visitability and ways that we can continue to allow people to age in their own homes, and ways that we can create housing opportunities that don't just discriminate against people with disabilities or folks who are in the aging communities, but both who are in great need of more affordable housing and accessible housing in California. So as we continue to take on those initiatives, I just hope that we push in looking through both lenses, disability and aging, the needs on both fronts.
Thank you. And one last comment from Michelle Cabrera.
Hi, making sure I come off of my triple mute here. Thank you, Michelle Cabrera with CBHDA, the County Behavioral Health Directors Association, and just wanted to add on to this conversation about housing in the homelessness space for those systems addressing homelessness locally. Oftentimes, the perception is that the majority of individuals experiencing homelessness are people with serious mental illness or substance use disorder conditions. Certainly, the clients that County Behavioral Health serves are among the more visible members of that community, and obviously have significant unaddressed needs at times. And at the same time, we know from Dr. Kushell's work with UCSF that age is one of the main determinants for homelessness. And we believe it's really important in the housing and homelessness conversation to think about housing accessibility as well as discrimination, in addition as it impacts people with mental illness and substance use disorder needs. Oftentimes there are structural barriers, there are NIMBY barriers and other things that make it especially difficult to find appropriate and available housing options for the clients who we serve, and just wanted to make sure that we remember that population as well in this conversation. Thank you.
Thank you. With that, I would like us to take a break for 10 minutes. I urge you to put your system on mute and turn your camera off, but not disconnect. And we will come back promptly at 10:45 for a round robin. See you then. Okay, at least one of my clocks says 10:45, so I will welcome you back to the second half of our Community Living Advisory Committee. We're going to jump right in. As you know from the agenda, we have 3 rapid discussions on housing, which has already come up a lot this morning, transportation and employment, and a little space for other opportunities, particularly emergency services. We'll have a brief update on our thinking about future meetings for the year, and then we will have that 30 minutes for public comment that we're very much looking forward to. And remind everyone, surveys link is live now in English and is available for input for the next couple weeks, and we'll be rolling it out in other languages coming soon. So please feel free to use that. Without further ado, I want to thank our panelists, all of whom did follow the directions and provide just 2 slides on such a huge topic of housing. So thank you in advance for your focused remarks today. Eric Dowdy, please kick us off on housing.
Yeah, thanks, Kim. So I thought it'd be helpful today to split the remarks into 2 different areas. So one focusing on supply and one on services. So if we could advance the slide. One more, I guess 2 more, I'm sorry. So the first couple items here are already included in the master plan for aging. They include accessory dwelling units and shared housing models, which are really a way to provide additional affordability and increase housing density. We think those are really promising, but we do have a caveat that we think that that is not also conducive for on-site supportive services always. So we still need to think about how to best coordinate services. The other areas that we're looking at are just examining the existing affordable housing models, funding models. I'm calling out the low-income housing tax credit program and the affordable housing sustainable communities programs in particular. For the tax credit program, the target is 15% for seniors, and then also the affordable housing or the AHSC program doesn't include any targets for seniors or disabilities at all. So they're more funded off the carbon credit funding for carbon neutral development. So we'd love to see more examination of those programs and see how we could better include the aging and disability populations. And I think the other area to look at is the congregate independent settings. They're still very important. Senior housing properties in general, I think, are very conducive for economies of scale. You can coordinate services with healthcare providers. They're very attractive to managed care plans who want to provide services. So making sure we keep our investments up in congregate independent living settings is very important. I will say that there are 2 funding bills not necessarily focused on affordable housing for adults, seniors or adults with disabilities. That's AB 71 and SB 5. So that would provide new money for affordable housing. And there's a Housing Roadmap Home 2030 report, which has really great recommendations, not all aging and disability specific, but the report is very comprehensive. And I know a lot of aging advocates and disability advocates were included in that. And I think also for the funding at the federal level, if you look at the Biden administration, their federal infrastructure plan has $180 billion to support 2,000 new housing units for elderly and persons with disabilities. We don't think that's quite enough. We'd love to see that around $600 million for 6,700 new affordable homes for older adults and persons with disabilities. So a lot of work, I think, still to do in that area. If you can advance the slide, I think looking at services, we have some excellent programs on which to build in California. The Integrated Wellness and Supportive Housing, or IWISH program, is actually in California already. California has 15 of the 40 sites that the federal government is funding. And this is a demonstration that puts together a service coordinator who is an on-site staff person who helps seniors access services. Includes that in addition to a registered nurse, which is something new. And together that team will help affordable housing residents navigate our system, which, as we all know, is very complex, so that they can access preventative care services. They also provide health education, so it's fall prevention, management of chronic conditions, and then also assist with transitions to home after hospital stays. So it's a very promising model. It's being demonstrated in 7 other states. So we hope to see a lot of improvement in that area with the expansion of something more permanent. The supportive housing demonstration, this is a bill that's currently in the legislature, AB 1083. This is a pilot program which would operate in 5 counties. It's an RN coaching model. It's very similar to iWish, but it's much more expansive and includes many more components in an interdisciplinary team who would help manage 125 residents, senior housing residents, care services. So it would be a great program to see here in California. And then also another program where it's more of a thought than actual program. This is the California Integrated Care at Home program, or SITCH. It was a concept that's based on iWish and Vermont's SASH program. And that is a larger demonstration that would include community-based services, home care, area agencies on aging, mental health providers, PACE program providers, all create this network of services for both people living in the housing community itself and then also living in the surrounding areas. And the benefit of this is not just, it could be in other programs such as non-HUD 202s, that's tax credit programs. So that's a real big benefit, I think, that we are currently exploring. Hope to see some movement on that very soon. And then, as Director Lightbourn already mentioned, we're looking at the CalAIM program and the in lieu of services. So the housing monies in there would be very beneficial, something completely brand new for folks transitioning and maintaining their housing. I think I did that in 3 minutes.
Thank you, Eric. Undersecretary Grant.
Hi, good afternoon, and thank you so much for that presentation. Again, I'm really glad to be here. Since we have three minutes, I thought we tag team with our Deputy Secretary, Lynn Von Koch, and just take 30 seconds to explain who we are. BCSH, we're made up really of 2 parts. We have on the first end, on the business consumer side, as regulating a lot of professional licensees, but on our housing piece, we actually look at it in about 4 different sectors, between the Department of Real Estate, between Housing Community Development, which I know many of you are familiar with, CalHFA, which is our housing financing agency. And one of the topics that I think has been brought up here, which is around housing discrimination, in which a lot of our civil rights type items are handled under Department of Fair Employment and Housing. And so we really tried to take an approach of a more coordinated system when we're looking at housing. And so with that, our approach into what you're about to hear today about some of the major opportunities that we see are really built under that premise from an agency perspective. So with that, I'll turn it over to Deputy Secretary Lynn Von Koch-Liebert.
Thank you, Undersecretary Grant, and good afternoon all. Thank you so much for inviting us to be with you today. So as the Undersecretary mentioned, and we really do have 2 places that we wanted to share with you all today. The first is really on regulatory and enforcement. The state over the last couple of years has been given a number of new authorities, powers, and resources to be able to help move forward critical production and get housing to those who are most vulnerable and who do need housing the most. So a number of initiatives that we have ready to go and have started are first the Pro Housing Designation Program, which regulations will be launching this summer, and we should have that wrapped up by the end of the year. And that is working directly with local jurisdictions who, by essentially creating an a la carte menu of policy options, can achieve the designation of pro housing. We really believe that will unlock a lot of development potential within jurisdictions. Secondly, we now have stood up a housing accountability unit, which is proactively looking at what is happening in jurisdictions around housing production, zoning, entitlement, and then taking really proactive steps to provide technical assistance and critical enforcement measures to keep production moving across the state. We also are getting ready to launch the long-term regional housing needs assessment and reform process. And that's the process that really shows, what the demographics of the state look like, what we're expecting in the future, and how local jurisdictions should be zoning and planning to be able to accommodate the needs of the state. And so that process is kicking off this year as well. And then finally, I'm really excited to share the link to the annual performance report dashboard. We're a second year running on having very strong enforcement capabilities to get jurisdictions to show us what they're doing, to show how they're performing against the state housing laws. And that dashboard is live and has a really great way to be able to see what's happening within your community. Next slide. And then I won't go into too many details because I know we're very short on time, but I also did want to highlight where we do have programmatic opportunities in housing. So the first is we are in the middle of the rental assistance relief program. So we have currently $2.6 billion in the first round, and then an additional $2.1 billion in additional rental assistance that is available now. And we are working with across the state to get those dollars into the hands of those who have been unable to pay their rent over the pandemic. The second is that we have stood up a housing counseling services program for those that have financial challenges around their mortgage. And then we're also going to be pairing that with a mortgage assistance program to help keep folks out of foreclosure. And finally, we also have the local early action planning grants and the regional early action planning grants that are being delivered to jurisdictions to help them be able to put together plans that meet all of the requirements that are coming from the state and federal bodies around land use, development, et cetera. And then finally, just really want to emphasize that we do have a lot of programs that are running between HCD and CalHFA, which are our housing finance entities, the tune of a couple $2 billion that are coming out in 2021 and 2022 to continue to provide financing to build and preserve affordable housing across the state. And with that, I have completed our presentation. Thank you.
Thank you so much. Director Johnson, take the baton, please.
Thank you. And again, good morning. I just want to really quickly close the loop on the IHSS question. Wages are impacted by both state minimum wage increases and changes as well as local. So just to close the loop on that. I just appreciate a lot of the conversation that I've heard so far on this topic, and grateful for the leadership of our Assistant Director of Housing and Homelessness, Corinne Buchanan, who will share a bit more about the programs that we have. Corinne?
Hi, folks. I'm Corinne Buchanan. Dr. Johnson mentioned I serve as the Assistant Director for Housing and Homelessness for the California Department of Social Services. So today I'm really happy to provide an overview of the Department of Social Services housing programs to end and prevent homelessness, and especially those that specifically serve seniors and adults with disabilities. So these programs are primarily administered by local county departments of social services, and they're really guided by a number of key principles. First is the principle of housing first, which means that these programs have low barriers to entry and don't have requirements, for example, for sobriety or adherence to other program rules for people to enter. We want to get people into these programs as swiftly as possible. The second is that these programs are all about cross-system coordination. And we actually sometimes joke that our middle name should be cross-systems collaboration. It's so ingrained in the work that we're trying to do here. And then lastly, and third, is that we're ensuring individuals have the supports that they need to successfully live independently. Really important to our ability to do our work. So I'll also just very quickly share that last month, we held a 2-day learning forum for our county and tribal grantees that was on meeting the needs of seniors experiencing homelessness. Just a quick thanks, because many of the folks who are here with us today actually participated or even helped lead that event. All right, so I'm just going to share about a couple of our current programs. The first is the Housing and Disability Advocacy Program, which provides outreach and case management, benefits advocacy, primarily for SSI, SSP, as well as housing supports for individuals who have disabling conditions, and especially those who are chronically homeless. A key outcome for this program, which we recently reported in our annual report, is that 78% of the SSI disability benefit applications have been approved through this program. So a great success of the program to date. I'll also describe the Home Safe program, which supports the safety and housing stability of individuals who were involved in adult protective services. And we do this by providing housing-related assistance using evidence-based practices for homelessness prevention, as well as housing intervention. I'll also share that we at DSS have been leading an effort called Project Room Key, which is our statewide effort to provide non-congregate shelter to people who are experiencing homelessness as a way to protect against COVID-19. It's a state-supported but a locally administered program that brought online over 15,000 hotel and motel rooms. And the project continues today and has primarily served people, especially seniors and people with chronic health conditions, as a protective and life-saving effort. Next slide. I'll also just share with you a new program that was proposed in the governor's January budget called the Community Care Expansion Program, which would provide $250 million in one-time general fund over a 3-year period for counties and tribes to support the acquisition and rehab of assisted living facilities. The goal of this program is to create new adult and senior care facilities that can effectively serve people who are experiencing homelessness with high quality care, with a focus on seniors and individuals with behavioral health conditions, as well as to stabilize these existing settings that serve people who are at risk of homelessness or unnecessary institutionalization in higher levels of care, like skilled nursing facilities. So I will leave it at that. Thanks so much for having us today.
Thank you. And of course, housing and transportation are close linked. We are very honored to be joined by Debbie Toth, who, while not a member of Community Living, was a member of the Master Plan for Aging Advisory Committee and worked on transportation recommendations. And then Secretary David Kim is with us as well. So we'll hear 2 slides from each of them. Debbie.
Hi, can you hear me okay?
Yes.
Yay. All right. Hi, everybody. I'm Debbie Toth with Choice in Aging. Thank you for the opportunity to be here. Choice in Aging is a scrappy nonprofit with 72 years of experience serving people with disabilities, specializing in older adults with multiple chronic conditions. Our goal is to support people living independently with dignity. And this means we do a lot of things like adult day healthcare, the multi-purpose senior services program, California Community Transitions. We were forced to do transportation, caregiver support, intergenerational programs that bust ageism. And we're also forced to do policy and budget advocacy because we live in a world designed for able-bodied, moneyed, 32-year-old white people. And this doesn't begin to address the beauty of all humans in our society. So one area I've seen in my 19 years at Choice in Aging that can be the difference between independence and institutionalization or radical reduction in quality of life and health is transportation. If you cannot get where you need to go, your life will suffer, period. Unlike the myriad legislative proposals and policy solutions for housing, we don't see any legislation impacting meaningful change in transportation. It's radio silence. Let's look at basic human needs. We all need to get to eat, to get to our doctor, to go to places of worship, see our community, friends, family, recreate outdoors, exercise, take our pets to the vet, and even get a haircut from time to time. So now let's consider that we're still a basic human and we just had our keys taken. Maybe we had a dementia diagnosis and our doctor reported it to the DMV, or maybe we voluntarily gave up our keys because we aren't safe to drive any longer. We have very limited options and maybe even no options if we live in rural California. Let's see, we have paratransit, which is absolutely better than nothing, but can be costly for folks on fixed income. And if you're incontinent or have dementia, a 3-hour trip to go 9 miles is not really what one considers accessible. There are taxis, but they're pricey and rarely are accessible for wheelchair users. Oh, and there's Uber and Lyft, but oops, not if you're a wheelchair user or have a walker you need assistance with, or if you can't afford $30 to go to the store and back. And if you're truly fortunate, you live in an area where you have a nonprofit that spends 30% of its time writing grants and fundraising to get enough money to provide 5% of its overall agency budget just to ensure a handful of people can have an accessible, affordable way to get around. So what happens when those options don't work for you? You get institutionalized, even if you don't require that level of care. In our CCT program, the California Community Transitions, we've seen numerous folks who landed in skilled nursing facilities because they could no longer get to the grocery store. Not everyone has children nearby or family or friends who can provide rides. For someone with a disability who is working, that 3-hour paratransit trip can mean the loss of a job because arriving to work on time is out of their control. For folks who can't afford it, it means they're making decisions about whether to go get groceries or go to the doctor, or perhaps not visiting their church or friends, or even getting outside. This broken transportation system speaks to an accepted practice of embedded ageism and ableism that must end. Now, I want to challenge you to consider whether or not it's okay that our transportation system is built for that 32-year-old I mentioned earlier. You know, the white able-bodied money one driving their single occupancy vehicle when they want, where they want. We invest billions in roads, street smoothing, bridges, etc. With accessible transit, we just study it, make recommendations, and change precious little. We must have a legislative and budget fix, as the transit providers and state agencies have been studying this and have commissioned those studies for decades. And despite findings that demonstrate how to build needs-based accessible transportation systems, the status quo continues to win. Even when that master plan for aging stakeholders provided extensive expert documentation and structure, it was discarded in its entirety and replaced with innocuous language akin to putting Band-Aids on severed limbs. We must fix this. Next slide. I'm going to ask you to have one goal in working on transportation: ensuring all people can get where they need to go when they need to get there, period. There's a structure in California law that, if updated and funded, can get us there. I think you have to invite me back, or someone smarter and less sassy, and dedicate more time to talk about it. For now, imagine a California that has ample volunteer driver programs, door-through-door assistance with groceries and ambulation, a ride being a phone call away, affordable, accessible cars built from the ground up, wheelchair users having the same trip time as non-wheelchair users. And when the DMV says, sorry, we need to take your license, it's accompanied by, and here are 15 affordable and accessible options that will get you where you need or want to go. Thank you.
Thank you, Debbie. Secretary Kim.
Well, good morning, everyone. It's great to see you. Big thanks to Dr. Galley and Director Wade for the invitation to join you today. Let me just say at the outset, in response to Debbie's very compelling presentation, the status quo is not acceptable. And we are trying to move forward and really show progress on all fronts when it comes to transportation. And so I want to briefly explain to you what we're doing. Let me start with the big picture. And I think many of you know this. The largest and most complex transportation system in the nation is right here in California. And our purpose at CalSTA, the California State Transportation Agency, is to make sure that the mobility needs of individuals, all individuals, as well as society at large, can thrive in a healthy, safe, and productive manner. That is our aspiration. The other thing I say all the time is that transportation is about much more than infrastructure like highways, bridges, rail cars. It's about people and meeting their mobility needs. And I think that's why what we're doing aligns so well with the purpose of this group. So let me walk you through a few things we're leading that advance the concept of transportation and community living. First is the Climate Action Plan for Transportation Infrastructure, or CAPDI, as we call it. This is based on the governor's executive orders on climate change that came out in 2019 and last year. And these executive orders are aimed at, among other things, reducing greenhouse gas emissions in transportation. And so CAPDI is all about expanding travel options and reducing our dependence on driving. As everyone knows, we live in a car-centric place. The state of California, and the nation for that matter, was built and designed for the car. And we are trying to gradually change that and make it possible for other ways to get around. And so the goal is to expand mobility options by prioritizing investments in transit. And let me say on that point, high quality, frequent, reliable transit. Also passenger rail, active transportation that's walking and biking, complete streets, micro-mobility options. Let me just say that the term complete streets is kind of a funny phrase, but the idea is to design or repurpose street systems that accommodate the needs of all users, not just drivers. So that means pedestrians, bicyclists, transit users, individuals with a disability, wheelchair users, parents pushing strollers, and so forth. There's a lot of synergy between CAPTI and the Master Plan for Aging, especially the part that highlights the need to improve walkability for older adults and people with disabilities. Next item is the Strategic Highway Safety Plan. This is a comprehensive statewide plan, and the goal is to move toward zero traffic fatalities and serious injuries on California public roads. And the premise is that everyone has the right to travel safely, regardless of race, socioeconomic status, gender, age, and ability. So the plan is built around a series of priority areas and actions, and that includes a focus on aging drivers, as well as crashes involving drivers over the age of 85. And so the question is, what can we do to support aging drivers? It includes things like expanding driver education and safety programs, and also identifying the driving habits, needs, and concerns of roadway users who are seniors. And of course, throughout, the goal is to promote safety. Third item, California Integrated Travel Project, or CAL-ITP. This is all about making the transit experience more user-friendly and convenient. And so CAL-ITP is an electronic contactless fare payment system that will eventually work seamlessly on every transit system in California. And there are over 300 transit operators in the state. For those of you who live in the Bay Area or LA Basin, you're probably well aware of that. So with CAL-ITP, not only can you pay your fare, you can also get your discount if you're eligible for one, for example, a discount for seniors or a disability discount. And so we're doing demonstration projects right now with a couple of transit agencies, SAC-RT and Monterey Salinas Transit. And these demonstrations will test the viability of CAL-ITP, and they will eventually set the stage for deployment in other areas of the state. Finally, a word on DMV. We've made a big push to make it possible for the vast majority of transactions, in fact, 97% to be exact, 97% of transactions can be done online. That includes renewing driver's licenses for people age 70 and older. Before the pandemic, senior drivers were required to renew in person, but we changed that last year. And the purpose behind that was to protect vulnerable populations from the need to come in for in-person office visits. And I am convinced that this action saved lives. One other point on DMV, as some of you may have heard, the US Department of Homeland Security just extended the deadline for Real ID to May 3rd, 2023, so 2 years from now. The original deadline was this coming October. So for those of you who have not gotten a Real ID, you have 2 years, plenty of time. And if your license is set to expire this year or next year, I would strongly encourage you to not only get your license renewed, but to get Real ID at the same time. This is one of the few transactions that does require an in-person office visit, but it's worth it. And again, you've got some time, 2 years, thanks to the Biden administration. And so with that, thank you for the time, and I'll turn it over to the moderator.
Thank you very much, Secretary, for, again, both of you for covering such a rich and deep topic in such a whirlwind format. So our final group to take the round robin challenge is the employment group, who I will have to say submitted the most slides. So Eric and Joe and Julia, I'm going to hold you to the 2 to 3 minutes. So that even though you have 4 to 5 slides each, and Eric, good thing you have a big event in May to promote, we can send everybody to as well. So with that, Eric, Joe, and Julia, please take it away.
Thank you so much, Kim, and you'll have to forgive me for not following the 2 to 3 slide directions. I will be thoughtful, and I know you know the group that I'm speaking with today. You all know about the employment issues among the disability community and the aging community, so I respect all of your experience, expertise in this space, and won't go into too much detail with the time constraints. So as we know, just kind of as a general overview, employment is so crucial for people with disabilities and the aging community. It gives a sense of pride, independence, respect, and of course in California, knowing the cost of living being so high, the cost of housing, transportation, other services being so high, it is crucial that people have legitimate opportunities for employment And now we know, especially for the aging community, that so many in the aging community have to work longer than they ever have before. In this generation, knowing that those who are in their 60s and 70s, in some cases even in their 80s, have to continue to work to sustain not only their own well-being, but also their families. So looking at some of the numbers have been decreasing in large numbers for people with disabilities and the aging community when we talk about employment opportunities across the board. Some of these statistics are on this slide, but it's really all over the place. You can easily find them on the overall numbers, but especially when we're talking about over this last year with COVID-19, with members of the disability community, members of the aging community, especially who intersect with race and ethnicity, having a difficult time finding employment. Next slide, please. Competitive integrated employment. I know you all know this term. Of course, competitive integrated employment was defined and used in the Workforce Innovation and Opportunities Act, which was signed by President Obama in 2014 in the federal regulations and at the federal level. And states throughout the country have adopted this definition as a way to clearly define how the types of employment opportunities that people with disabilities are advocating for. We, as a community, are advocating so that we have the opportunity to work in a competitive workplace with wages that are equal to those without disabilities, in an integrated setting where we are working alongside with people without disabilities, and employment opportunities that are either part-time or full-time employment opportunities. This is crucial, and elements of this have been examined in California, of course, through the Blueprint, which has been a space and an opportunity for the agencies and disability organizations to work towards having people with disabilities in a competitive integrated employment space. We hope that the work here with this group, as well as the agencies involved, can continue to push forward the Blueprint and make improvements to the Blueprint so that all people with disabilities and all people within the aging community do have opportunities for competitive integrated employment. Next slide, please. There are programs in our state like the Limited Examination and Appointment Program, and there are, of course, others, the Paid Internship Program. These are programs that give people with disabilities opportunities to be involved in employment within the state. A lot of times, as we know, those opportunities start with internships. They start with having proper programs, mentors, and really giving people with disabilities initial opportunities to be involved at the state level with agencies and departments. Next slide, please. So building back better with diversity, equity, and inclusion, Disability Rights California is working with leaders from throughout the state and really throughout the country over the next several weeks into late May, and putting together an employment summit where we will have discussions from a policy level to really get at employment opportunities and the economy for people with disabilities coming out of the pandemic. We're really trying to make sure that California is a part of building back better, really making the improvements necessary. And that means that people with disabilities aren't left out. Too often, the disability community, the aging community has been forgotten about when it comes to employment. Either people think that the disabled community doesn't want to work or cannot work, or the aging community is retired and doesn't want to work. But what we're really trying to push as an organization and we want to make sure that policy leaders throughout the country are aware that the disability community and the aging community wants to have opportunities for work, and we need to develop a plan to make sure that this is possible for all people with all types of disabilities. So thank you so much. I believe that that is my last slide. Thank you.
Thank you, Director Xavier.
Hey, Cam, can you hear me?
Yes.
Okay. So good morning to everyone. Our mission here at the Department of Rehabilitation includes both employment and independent living. And so today I'm going to focus specifically on employment and build on what Eric has already started the conversation, what many others have said. We certainly all have heard over and over how COVID-19 has exposed the gaps, but it also has highlighted opportunities that I think we could be taking advantage of when we think about employment. And so when you think about the question of what's the major opportunity for employment, I want to offer a little bit of a different perspective than simply the initiatives and the ideas that are underway, which are all wonderful. Eric, thank you for mentioning a number of those. There are many others, but I really think for us to take advantage of the opportunity before us, it's looking at this in a very long-term way to have long-term impact on the unemployment rate for people with disabilities, because frankly, for decades, it has moved negligibly, if at all. So what does that mean? I think we really have to go back to the basic premise that Dr. Galley laid out, which is a whole person care, a whole person approach, which includes seamless systems alignment across all of the individual's needs, right? So everything that has been said today has a linkage to employment. So if you look at the fact that employment is a social determinant of health, and you start with building into the health system, what are the supports that are needed so that people who are employed rely less on the healthcare industry because they have better health. They rely less on the basic costs of health because they're employed. And you start looking at housing, transportation, all the things that were mentioned before. All of those are very linked to employment, right? But however, we often don't think of those supports in the context of employment, and we don't think of employment in the context of living independently in your community of choice. So I think it's the opportunity is really to say, what are the elements that we can align around these individuals, around the individuals with disabilities? And for those of you who don't know, much of the testimony from individuals I share. I'm also somebody with a disability who's traveled these paths and had these experiences. So when you think about employment, there are really three elements that we really have to be thinking about. What's occurring upstream? What are we doing from birth to get an individual with the most significant disability truly ready for employment? And then what are the things that we're doing to help that individual at working age to be ready for real work in the real world for real pay, which is the genesis and the focus of the blueprint that Eric mentioned. But then at the end of the day, you have to say, and getting the job. And who decides that an individual with a disability is ready for the job? Who decided that I, as a blind guy, was prepared and ready to take the job that I have today and the ones that I've had before? And frankly, when we think about that, we got to think about where those opportunities lie. And those opportunities truly lie with every single person that hires, right? Small business, the governor sent out a press release yesterday that highlighted small business provides 2/3 of the jobs in California. And so when we think of that, we have to be thinking of local government. We have to be thinking of for-profit, nonprofits. All of these types of industries are the focuses that we need to be thinking about. And frankly, at the end of the day, all of us sitting on this call today who are hiring managers, we've got to be asking ourselves, what could we do? What's in our systems? What's in our practices that if changed will provide a greater opportunity for employment? So on slide 2, and Kim, I promise I won't read all the slides. If you look on slide 2, really, we have to think about supports in the community when we say that they're necessary for independent living: affordable, available, accessible, transportation, assistive technology, personal care attendants, all things that are needed to live independently, all same supports that are needed to be effectively at work. And so there's a number of shared supports that I think cross all of the spectrums that have been talked about. One of the other things that needs to be thought of here is when we think of individuals who are in institutions and what they need to transition out of those institutions. And we got to be thinking that for those that are working age, employment is such an important aspect of that, because truly, at the end of the day, the best antidote to institutionalization is giving someone the opportunity, true opportunity, at a family sustaining wage. So on slide 3, there's a list of policy bodies that help inform policy for individuals with disabilities. So invite you to join that and participate in those as much as you are able to. And then, of course, today's true employment opportunity is really recognizing that for somebody to have an effective employment outcome, we got to start at the earliest possible age. We have to believe that anyone with the most significant disability can and will go to work with the appropriate supports. And we also have to recognize that business, all of us, and all of our business colleagues up and down the state need to provide that opportunity for individuals to truly have that access. There are a number of funding streams that have come out. We've heard about them this morning. What I would say to you when it comes to employment, none of those directly target employment of individuals with disabilities, but every single one of them provides opportunity for individuals with disabilities to go to work. So those of you engaged in those systems, we certainly do everything that we can to ensure that that engagement includes providing meaningful opportunity to employment for individuals with disabilities. So hopefully I didn't go too far over, Kim, and I'll stop there and turn it back over to you.
Thank you, and I'll hand it right to you for labor agency's perspective.
Great, thank you so much. And thank you, Maria, for including these slides at the last minute. If we could go back to the first slide in this, there we go. So this is a little hard to read. This is more for people to have at their, available to them. I just wanna highlight that, you know, it's a snapshot of where we are with workforce and unemployment right now. It's not good for anybody right now. But as with many things that we have seen in COVID, you know, this sort of laid bare a situation that was already worse for older adults and for adults with disabilities. The overall unemployment rate in California right now is 10.9%. For people with disabilities, it is 19.6%. And that number is astonishingly high, but I think it's also important to point out that it is not the largest increase. The largest increase was actually for older adults, but what it demonstrates is that the overall workforce participation was already very low, and that is troubling. And that is, you know, everything, you know, that was just spoken about. You know, the obstacles and the barriers to employment generally for older adults and people with disabilities. Next slide, please. So this is just a brief listing of the programs that are specific to addressing barriers to employment for people with disabilities that are run out of the Employment Development Department, which is within the labor agency. In addition to these, and there's some overlap with what was already discussed, there's also a disability resource coordinator program, which is was meant to be in person and has had to move online, unfortunately, and is being integrated into an online format. There is no specific program addressing barriers to employment for older adults that is managed or run out of the labor agency. The Senior Community Employment Program, which some of you might be familiar with, is funded by the Federal Department of Labor, but is actually run on the county and local level outside of the labor agency. And that, I think, I wanted to address that specifically in the larger context along the lines of what Eric was discussing, and, within workforce development, there's a move generally to move away from sort of population-defined approaches towards inclusion of older adults and people with disabilities. As Eric was mentioning, competitive integrated employment. And within the workforce development world, part of what that means is sort of focusing on employer-driven and industry-focused programs, which were also mentioned. And I think it's also worth noting that, part of the reason for this, there are many reasons why this is not just a sensible goal, but also a sensible process in terms of what the workforce development program should look like in terms of addressing the barriers to employment in the first place. There are some, although the barriers that face older adults and adults with disabilities are distinct, there is some overlap, most significantly in the stereotypes that are quite prevalent, that these populations are slower to learn and adapt, which leads to them being the first to be laid off and to a much higher rate of long-term employment. Also, as was mentioned, the emphasis on whole person care is translated in the workforce development arena into wraparound services. And I think, in addressing many different kinds of barriers to employment, we have found that to be the most successful strategy for not just securing employment, but retaining employment. On the next slide, there's just a list of, I won't go through all of this, but this is just so people are familiar with, it's an intricate infrastructure and bureaucracy for all of the different workforce support programs. These are not specific to any particular population, but the work currently of the agency is, as I said, to integrate all populations that have any sort of barrier to employment into these programs. And I wanted to highlight the Hybrid Training Partnership because it's a particularly new and innovative program that focuses on building relationships with high-rolled employers. And I think it's sort of fertile ground for emphasizing, one of the framing principles is equity. And so I think it's fertile ground for the inclusion of adults with disabilities and senior adults. And then the last slide is really just for to demonstrate that we could be doing better, and we need to be doing better. And I know that there's been a lot of effort recently at integration and coordination between DOR and EDD. And I think this sort of demonstrates the need for that and the reason why it's a priority for both agencies. Thank you.
Thank you very much for the round robin participants for doing what we had hoped to do today, which is really set the table for many more conversations to come. I am going to shrink 2 10-minute items to 1 minute each so that we go to public comment in about 2 minutes. Claire is nodding, Eric is not. I think that's okay with Eric too. So the other opportunities, I just wanted to name a couple that have been raised in pre-meets. One is around emergency services. Vance Taylor, the Chief of Access and Functional Needs at OES, is very powerful and articulate on this topic, as is Christina Mills and others. I believe that will be a topic coming soon and is worthy more of 30 seconds from both of them and from all of you, especially as wildfire season, we turn the corner on that next week. So that is on the table for sure. And I also want to acknowledge our partners in Veterans Affairs, who are part of the federal effort to convert all federal veterans nursing homes to small homes nationwide. And we learn from that in California and statewide, and the other work in the master plan around nursing homes, California veterans homes, and many of the community-based services, homelessness and other issues that we want to partner and integrate more with the veterans programs as well. And a third suggestion has been talking more about our No Wrong Door vision of how we help the public access these wonderful different systems in an aligned and coordinated way. So those are just 3 of the topics that have been suggested to us in pre-conversations. And that leads to the next item, which is how are we going to structure our meetings going forward? We have committed to be quarterly, although here we are starting in April, which is the second quarter of a pandemic recovery year. So we welcome feedback on whether there's 2 or 3, recognizing there's plenty of content, but we also want to be mindful of how I believe several people said earlier, it's been a full year and there's more to do. And we also want to not just meet to meet. So, and recognize that most of you, if not all of you, are double or triple or quadruple duty, which is the strength of this committee, your dotted line over to Alzheimer's Advisory, Behavioral Health Task Force, and on and on and on. And so we want to leverage those dotted lines, but we also don't want to overmeet. So that is one of the questions in the survey that you see linked here, and again is on the CHSS, and we hope we can get feedback from committee and members, is how often we meet, how we structure these meetings. We've packed a lot in today, and we won't do this again, but we want to at least set the table and make sure that we were bringing together that true home community-based view. So let me just pause and see if Eric, Claire have anything to add to that kind of other topics or meeting structure, and if not, we will move to public comment. Eric, Claire?
That all sounds good, Kim.
Yes, it sounds good to me. Thank you.
I'm seeing nods. Okay. So we are going to try to do close to the full 30 minutes of comments. We had put in the pre that we would, let's see how the queue is. I know in some legislative hearings, they 1 minute, that's pretty fast. So, but I want to make sure we hear from as many voices as possible. So if people can aim for 1 or 2 minutes, and I will turn to Maria. Oh, great, the queue is forming to get us started.
Thank you, Kim. Erin, it looks like you've had your hand up for a while, so we will open your line. Please remember to unmute yourself, and then you can share your comment.
Thank you so much. Hi, this is Aaron Carruthers from the State Council on Developmental Disabilities. Thank you so much, Director McQuaid-Wade. Thank you, Secretary Ghali, for doing this. And thank you, Rosie Ryan, for representing the State Council on this body. The 3 key elements, as you know, to community living are a person needs a place to live, they need supports to succeed, and they need opportunities for a full life. And from the intellectual and developmental disabilities perspective, DDS and regional centers, they do their very best to provide thorough wraparound proactive services to help people succeed, but they sort of have the expectation that they can do it all, and they can't. The service systems outside of DDS and outside the regional centers need just as much as attention. I'm thinking of education, housing, employment. The State Council on Developmental Disabilities produced a strategic framework for housing, and we have been looking at the many housing funding opportunities that have been coming in recently for ways to create a set-aside funding pot for housing for people with intellectual and developmental disabilities. Again, one of the key elements to having a place to live, supports to succeed, and opportunities for a full life and employment. So looking forward to working with the state entities on those efforts.
Thank you, Aaron. Let's turn to Shella.
Hi, good afternoon. My name is Shella Komin-Dumong. I am the family member of a 30-year-old who has Down syndrome. I'm also the executive director of Chance Housing, a nonprofit agency that provides for the affordable and accessible housing needs of people with disabilities, seniors, and including people with developmental disabilities. Lastly, I serve as a member of the state's Developmental Services Task Force. I just want to commend Health and Human Services. I'm very excited about this newest evolution of the former Olmstead Advisory Committee. I have the feeling that with the leadership of Governor Newsom and Secretary Ghali and all of the members of this committee, that California is really going to see some progress in community living. And I'm so excited to participate and watch and see how this goes. I look forward to it. That being said, I also would like to participate on any work group or subcommittee dealing with housing and access to housing for people with disabilities, older Californians, and those with developmental disabilities. Thank you very much for this fantastic meeting.
Thank you, Shella. And I know we've had quite a robust discussion about housing, and Connie Arnold wants to remind us in the Q&A that housing also needs to be accessible. There needs to be accessible housing that's supportive of folks with physical impairments, visual, hearing impairments, and so we'll keep that in mind as well. Marissa Shaw, we've opened your line.
Hi, can you hear me?
Yes.
Okay, I've got a lot. I'll try to see what I can do to condense it as much as possible. First, I agree that housing needs to be accessible and affordable. A lot of people with disabilities are low incomes, as we looked at the reports from DR and Department of Labor. I will also say that in regards to supportive housing, there, especially in the Bay Area, but also in other parts of California, for those who have the ability to work, or possibly the ability to work from home, given the pandemic and the situation, even though we seem to be coming out of it, I think working from home is an awesome option. However, I have to say that, for example, I have a master's degree, and one of the reasons why I don't work is because I can't, like if I became unemployed, there'd be no way I could afford the rent within the Bay Area. And so it's one of these situations where people with disabilities such as myself wind up having to make choices about whether to stay on a public benefit or whether to take the chance and see if they can get a job that supports them. But if they lose that job, they will, there's a big potential that they will not be able to make their rent if they don't live in some sort of supportive housing program. And I think that, when you talk about connections within the community and supportive, community services, and you talk about like housing and, I think there needs to be a sort of bridge gap between what if somebody takes the risk and actually goes out and looks for a job and gets one, and like, let's say if they're moving from Section 8 to something else, there needs to be a bridge gap between people who need like some sort of supportive housing as they go on their way to being independent. Second of all, I just want to say in regards to attendant care, as was kind of mentioned with the report on aging, there needs to be some sort of backup system, and I'm concerned that if a bunch of money just goes to the current public authority system, that's going to create more problems and nothing is really going to get done. And I'm also concerned about wages for attendant care. That really needs to be looked at, or else we'll continue to be in the same situation we are now. It's not just attendant care for IHSS, it's attendant care for those on various different programs, and I think that needs to be looked at. Thank you very much for your time.
Thank you, Marissa. And I wanted to share a comment from Tammy that I think Claire may have beat me to. It's in the Q&A, and Tammy writes, under the Working Disabled program of Medi-Cal, the income limits in place grossly hinder a disabled worker from pursuing greater income opportunities. Are there changes to Medi-Cal policy that are being considered to fully expand the California competitive integrated employment? So thank you, Tammy, for sharing that. I also want to underscore another comment from Connie, and this relates to accessibility, that when we talk about accessibility, we're talking about accessible housing, but also accessible state buildings, and we have to keep that in mind as we continue to grow and expand. Feel free to raise your hand if you'd like to join the queue for a verbal comment or question. We'd love to see you. We'd love to hear from you. Ethel, we'll open your line. Go ahead and jump in.
Hi. Sorry, my jaws. I have a screen reader. I'm totally blind. It's been a wonderful meeting. Been a privilege to hear all you, and it gives me a lot of hope. I just wanted to really emphasize that need for affordable housing. I'm in the San Diego County area, and we on SSI, but I do have my education, but I'm constantly at the cliff's edge, trying to maintain that roof over my head, knowing I can't depend on my health because the blindness is due to juvenile rheumatoid arthritis, which is a degenerative disease. I've had bilateral knee replacements, and it's just going to go on and on. But I can continue to live a full life. I can continue to adapt, but we do need those basic supports. We're hanging in there, but I've seen a lot of my blind community fall away, move away, out of state, get pushed out. and there's just no place for them. And that, I know that's not for real. There's gotta be better, and we will continue to do better. I know there are good people out there working on policies to help support us moving forward. We have a lot to give, a lot to contribute. Thank you very much. Keep up the hard work.
Thank you, Ethel, and thank you for sharing. Let's hear from, and I might pronounce this wrong, so please feel free to jump in and correct me. Ligia, your line's been open.
Hi, hello. Yes, my name is Ligia Andrade Zuniga. I'm from San Mateo, California. I wanted to just give a comment about CARE and about a part of the presentation that was given. Sorry, I can't remember the organization, but they were talking about in-home care workers and rights and things like that for the in-home care worker. With the IHSS program and even WPCS and all of the other like care programs out there, there needs to be a plan for sustainability. We have a huge shortage of care providers in this country. We're competing with hospitals and with nursing agencies and other places that would pay them a lot more money and give them a lot more, maybe not just, you know, monetary benefit, but also access to other types of opportunities within their careers. And so the IHSS program doesn't really give any incentive in that sense for younger people that want to, excuse me, that want to work with recipients of the program. So there, again, you know, there should be some sort of sustainability, perhaps partnering with nursing agencies or nursing, or like in terms of nursing programs that will give students an opportunity for like a nursing position, perhaps partnering with local health plans. Like I serve on the health commission for the health plan of San Mateo, and you know, maybe there could be a partnership with people or with organizations like that that can give maybe a leg up over other candidates for nursing positions within the health plan or within the county hospital if they work with the IHSS program. Perhaps also having more opportunities, like giving, like in terms of payment, like different tiers where people that, you know, want to do just some basic errands or basic things get, you know, paid okay. Like here in San Mateo County, it's $15.25 an hour. And then people that work with people that have more complex needs could make a lot more money. So there has to be some other incentive for people to want to be part of the program to be able to sustain it, because what are we going to do when more people start retiring and more people start getting sick or whatever it is, you know, that people get, you know, have injuries or other illnesses. So we have to, right now, the infrastructure of the program is collapsing. And so something has to give. I'm a local elected official. I'm also on several commissions and boards throughout the county I live in and the state. And I've been stuck in bed for 2 months. It'll be 2 months on May 1st because I have no care. I cannot access any caregivers to want to come and help me. I'm a quadriplegic. I have a spinal cord injury, so I have very complex needs. And right now there's, I've been through like 60 plus caregiver interviews and connections in the past 2 months. When it comes to talking about what my needs are, people don't want to do it. Or the pay, it's either they want to do private pay at $25 an hour and over. I had someone ask me for $50 an hour, which I understand their skills in certain capacities are very necessary, specialized, and at a level of professionalism. However, most people here where I'm located are not looking for that type of work. So again, I don't know what to do. I don't want to continue in bed. And I'm sure I'm not the only person in the state that is dealing with the same thing. So I'm also the chair for the Public Authority Advisory in San Mateo County. And, there's just, I don't see any solution or any support from our leadership as well. So I don't know what the answer is, but I'm just wanting to put that out there that there has to be a plan, and or we're all going to be at risk of being institutionalized again. Thank you.
Thank you very much. I do want to take a stab at summarizing some comments in the Q&A from Connie, who just wants to underscore the importance of addressing shortage of care providers, working with colleges on student loan forgiveness, again, just to build up the workforce. And Connie, I'm frantically searching. Oh, yes, and the shortage of care providers. Okay, thank you very much. We do have somebody who's calling in. The last 4 digits are 6806, so we'll open your line. You may need to unmute. Last digits 6806.
Maria, while we are waiting for that, there are no other public comments in writing or hands up. I thought we could perhaps call on 2 committee members who have not spoken yet. I see committee members raising their hands. And again, I want us to keep our eye on the public comment, because if there's public comment or people can unmute, let's prioritize that. But if we have the time, we haven't yet heard from Corinne Jones, I don't believe, or Sylvia Yee, so I'd love to give them a chance as well.
Absolutely.
Hi.
Corinne, you can.
This is Corinne. You can hear me?
Corinne, excuse me. Yes, Corinne.
Okay. What I wanted to raise as an issue is perhaps creating and highlighting an opportunity around food insecurity. In areas that are rural, I'm in Lake and Mendocino County, as far as older adults are concerned, and especially even for urban areas where there are people of color, et cetera, there are just sometimes ridiculously limited food options that are of quality. McDonald's on every corner, but a very limited amount of what we call good food choices. And we know for sure that food insecurity is a social determinant of health. So, and it should be right up there with housing, in my mind, and transportation and such. So I just wanted to raise that and see if there's an opportunity to maybe give some focus to that being one of our other opportunities. Thank you.
Thank you. Sylvia.
Thank you. Sylvia Yee from Friends of Children with Special Needs. I have 2 comments on that. First of all, I really want to thank Julia for the direct care workforce. And I think we've been advocating that our caregivers, you cannot just compare with working like the McDonald's, that they are taking a very vulnerable people. So the rate is just so low on that. However, we've been addressing that. I want to add it more, just like, the insurance coverage. If we can set up some system like IHSS, provide health insurance for these people who are the caregivers working for the CBOs, and to take care of these vulnerable people. If we cannot increase their salary, but with the insurance coverage, which is a tremendous burden to the nonprofit agencies on that. So if we can have that resources and we can talk about this, establish a system like the IHS is covering for the insurance, health insurance, that would be great. And second comment is toward Director Kim for the transportation. I think, we are talking about reopening very soon, and really soon, like June or even shorter than that. And we really need a cross-board guidance for the transportation, like the BART, the bus, paratransit, and also the vendorized transportation program by Department of Development Services, because we were told you have to keep 6 feet distance, social distancing. Then that means we can only transport 1 person in the vehicle. And usually in the past, we are transporting 3 or 4 clients. Now we just don't know how to operate that. So we need a directions from the transportation, tell us what are we doing, and this guidance will be across the board on that. Thank you.
Thank you, and we'll turn to Debbie Toth.
Thank you. We're going to return to public comment and do a couple more public comments. Thank you, Debbie.
Thank you. I am a member of the public. I'm not a member of the committee, although I did have the privilege of presenting for 3 minutes, and I may have taken advantage and presented for a minute longer than that. But I just wanted to, as a member of the public, say that if there are others on this call or Zoom or whatever it's called that have an interest in working on this transportation issue, I would like to invite you to reach out to me. We are sorely lacking advocates, and yet this is, as I said, one way that people get institutionalized when they don't need to be. I have to believe that the system does not understand what it is to be a human being with a disability in a world with inaccessible transit, and we have to follow the money. If you just look at the American Rescue Plan, there was $30.5 billion dedicated to transit agencies across the nation. 30 billion. And only 50 million across the entire nation for seniors and the disabled. And we have how many housing bills? Because there's money, because we have developers, but we don't have that same kind of money dedicated to senior and accessible transportation. So anyway, I want to invite people to please be a part of this movement, because it has just been stagnant for far too long. We see movement everywhere else, not here. I want to thank Claire and Eric and Director Kim McCoy-Wade for your leadership, and Secretary Galley, and I look forward to making some serious waves.
Thank you, Debbie. I just want to pause for a second and see if our caller with the last 4 digits, 6806, is able to unmute themselves. Your line is open on our end. Give you just a couple of seconds. Okay, how about Bill? Bill, your line's been open. Bill, I see that you've unmuted, but we're not able to hear you.
Can you hear me now?
Yes. Yeah.
Okay. Thinking holistically, I want to circle back to the CalAIM presentation. It would be tremendously helpful if the CalAIM could provide scrubbed local encounter data that would be shared with the local ADRCs to help target community outreach and target specific community health and human service initiatives. And since they're going to be one of the doors that the community comes to with that, it would be helpful to have a real viable data exchange there. Secondly, I want to also say that as a person that worked in an agency where I supervised a team of in-house caregivers for people who attended our program, providing feeding, toilet, and hygiene, I would like to say to everybody, particularly on the comments of Miss, I don't know if I'm pronouncing her name correctly, Zuniga, who recently spoke this morning about caregivers and direct service care workers. They are the backbone of community-based care. They are the backbone of the health system. And I will say, as somebody who was in the position of hiring people for caregiving, if you haven't worked that directly with caregiving, I would remind everybody, you can train skills, you cannot train caring. And not everybody, even if they're applying for a job and the caregiver, has the grace to provide care, particularly personal care to individuals with disabilities or chronic health conditions. And so this is a very special workforce. And lastly, I would like to say that back in the day, the Northern Regional Center in California had a pilot program where they were training individuals with intellectual and developmental disabilities to be caregivers. That was a successful program. And one of the things they discovered that people who have the physical ability to provide caregiving, but maybe living with other forms of disabilities themselves, were particularly caring to individuals with disabilities that they were serving as caregivers. So I think that this is a population of potential workers that might generate valuable employees. Thank you.
Thank you, Bill.
Thank you. That concludes our public comment. I'd like to do a quick run through of the next steps that I captured and see if committee members have others to add, of course, and give Eric and Claire the last word. So we'll be posting shortly the survey in other languages, so stay tuned for that and extending time, of course, to promote that. We'll be following up with 5 of the members who weren't here today to make sure we've got the right information. And I want to acknowledge that Erica Steele from the Commission on Aging was able to join us partway through, so welcome, Erica. We also will take Marty's suggestion about the inclusion of education, higher ed back and consider that. Thank you for raising the education continuum as well. I'd also like to post some of the additional content that was discussed here. Claire mentioned the LTSS holder recommendations. We just received Rosie Ryan's written comments. Peter, I'd ask you to send the same. And Peter, you also shared very valuable history. I appreciate you starting that history lesson. And so again, we'd like to link and build some of that out so that we have our collective history and knowledge pooled together. As Claire says, we're not starting from ground up. And then in May, we will have the survey results back and we'll share with the committee. And we'll also do some more thinking on agendas and calendaring so we can get on people's calendars before, well, you're both planning your summer vacations, I hope, and also remaining, I know, very busy with the work at hand. So we welcome input through the survey, through the CHHS email. It's quickly posted, which will get routed to the committee leadership. And of course, always welcome to contact me as well, and our team at agency, Marco Meij, Under Deputy Secretary, and Secretary Galley as well. Other next steps I'm open to, or Claire or Eric, last word.
Yes, thank you so much, Kim. I really appreciate everyone for being patient and sticking with us. I know 3-hour meetings aren't always the easiest, but really means a lot to Kim, myself, and Claire. We try to stay diligent and put an agenda together that works for everyone and that gives everyone an opportunity to give input. We really take the community input very seriously. And I hope moving forward, we can continue and put together some action items and some positive steps moving forward, so that not only are we meeting together once every few months, but that we actually can list out some accomplished goals and objectives, and then report back to you all and communicate directly with the agencies, departments, and legislature, of course, and the executive branch to make sure that the needs of the disability and aging community are met. I'm really excited to continue this work, and I'll be sensitive to the time. I know it's just after 12 o'clock, but I hope that you all feel free to reach out to us if you have any questions or concerns. As Kim mentioned, we really want to follow up with some of the concerns that were brought up on this initial meeting. I know there are a lot of policies and bills and budget items that are going through the state legislature that we want to make sure that we are connected on and working together to make sure that those get accomplished. Disability Rights California, the Department of Aging, Justice and Aging, and so many other groups are working hard to make sure that these policies have a positive impact on the disability community. So I look forward to continuing to work with all of you, and please feel free to reach out to me or any of us. But I know both Kim and Claire are ready and anxious to help out in any way that we can and be supportive of this group. So I look forward to working with everyone.
Thanks. And I just want to add 2 things on to Eric's closing remarks. I saw that Paula had tried to unmute her line a couple times and wasn't able to. So put in the chat that one of the things that didn't get raised was SSI and the need to improve SSI and income through that source. So thank you for that comment, Paula, and I'm sorry we weren't able to hear you through our line. And also I know that there were some committee members who had hands up and we weren't able to call on because of the tight timeline. So we'll just really work, as Kim said, this was a really presentation heavy and we knew that, but that's not going to be the format going forward. So we'll just make sure there's both always lots of public comment time, but also lots of time for committee members so that we make sure we hear from you. If you did have your hand up and we didn't get to, feel free to send us emails to let us know what your comments so we can incorporate your good thinking into our planning. And with that, thank you again, and really excited for our first meeting to be done. And and that we were able to hear from so many voices. Thank you. And Kim, I'll turn it back to you.
Thank you so much. And I will just say thank you for spending your morning and really your commitment to move this work forward with us in this new and energized way. And I wish you all a very restful and rejuvenating weekend. And I will see you in May. Thanks so much.